Hello, hello, hello to all of our patrons of physicians working together, all the physicians and students and others who support us. We just want to thank you for tuning in. We have with us another one of our winners of the 2024 Physicians Working Together Medical School Scholarship. And you say your name, your whole name for us, because I do not want to butcher it. It's a beautiful name. So would you tell us that?
Yeah, so my full name is Chibundum Ezenwuka, but I go by Bundu.
So I'd asked you earlier about the meaning of your name. Would you share that?
Yeah, it means God is my life. My parents are very Christian, and it's very common in Nigerian names to have meanings that are kind of, related to God.
Yeah, yeah. Well, that's awesome. I really appreciate when parents are intentional about naming naming their child with some kind of meaning, giving them purpose from birth. So beautiful, beautiful. So let's talk about how you first heard about PWT and the medical school scholarship program.
Mhm. Yeah. So there's a big kind of group chat for African American medical students. And I just saw that someone posted a flyer about the talent scholarship in the group chat. And I thought that was really unique because I feel like a lot of scholarships, they kind of just make you write an essay or something. And so I thought that it was cool that they're, highlighting people's talents and like kind of showcasing a more creative side to medical students. And so I thought, why not apply?
Excellent, excellent. Yeah, and that was very much the reason for Dr. Jackson setting up the scholarship in that way. When we first talked about doing it, oh gosh, how many years ago now? Maybe 5 or 6. I'm trying to count. We've been doing it for a minute. But when we first talked about doing it, that was the thing. She wanted to be something unique. And because she's, of course, gone down the road that you've gone down, we wanted to make sure that as well students were highlighted as being people, just as she started Physicians Working Together because she wanted the community to realize your doctors are people too. They have their issues. And then for the physicians that are out there, to have a place that was felt safe to come to be able to meet together as well as with the public, with the lay people, and talk about things and kind of level the playing field so that it wasn't doctors here and everyone else there, but that we all need to work together for the benefit of our well-being. So wonderful. So now your talent was a little bit different than most. It was one of those I would say probably is a little unexpected. What
Mhm.
was that?
So my talent was crochet.
Yes. Now,
Yeah.
how long have you been doing that?
Not super long, honestly. I started in maybe like November or December of 2023. So
Uh-huh.
I guess it's coming up on a year, but
Okay.
I feel like I kind of tend to go through phases of things that I'm
Right.
interested in. And when I was younger, me and my sister like learned how to knit just for fun. And so,
Neat.
I was in med school. It was stressful. I kind of just wanted a little hobby to take my mind off things. Plus, I could, watch TV while I crochet. So that was nice. And yeah, I really loved it. I kind of got into making like little purses and made some decor for my room. So yeah, it's really fun.
Excellent. Have you made anything for others yet? Have there been
Not
any requests for you to make something?
There have been requests, but not I'm not taking commissions just yet. I want to still keep the love and the passion. I don't want to make it
Right.
work.
We're not trying to turn it into a business. Yes.
Right.
So I'm understanding that mainly for you, it was you're wanting to basically have something to help you deal with the stress.
Mhm.
And you did say that, you kind of go through seasons, if you will, of doing different things. What are some of the other things that you found that have been comforting to you, calming to you, that you
Yeah.
were able to do?
So when I was younger, like my family was pretty like very musical, so I really like to sing and dance, and so I play the piano a little bit. I like to sing just when I can. And then in terms of like wellness, I really like to journal, and I go through seasons of that when I'm a lot more consistent than than others, but journaling really helps me kind of like get my thoughts together. And it's a way to like be intentional and like slow down and kind of like
Mm,
reflect on things.
beautiful, beautiful. Ask these questions because as you go through your med program and then finish, and we're believing you're going to finish with, just no problem, just breeze on through because you're doing the studying right now. So yes, yes, yes. But when you get on the other side, I think some of these things are going to still be important for you. But another thing that Dr. Jackson and Jennifer and I, our board, was speaking on concerning what you do with the crochet was kind of the fact that it's because it is something that's unique and that it can be used for, as you said, kind of calming, comfort, like we have comfort foods, that's a comfort in doing that particular hobby. I think that's probably something that you could use in helping your patients or even helping them find when you see that they have maybe elevated blood pressure, asking them those questions and letting them know, hey, I used to do, what are some things that you might be able to do? Do you see how your experience could lead to that with your work with patients?
Yeah, 100%. And like that's something that I'm really like interested in is, kind of like the like lifestyle medicine and,
Mm,
figuring out different ways to promote wellness in your life because
yes,
like if you eat well, have stress reduction techniques, like maintain good relationships and all those things, like that benefits your health a lot. And so, yeah, 100%. Like I really see myself like I guess being an example for my patients, so if
very
I'm
good.
have different stress management techniques, like having hobbies, maintaining the relationships, like eating healthy, exercise, then it'll be a lot easier for to kind of talk about those things with my patients because it's like, well, I mean,
Yes.
this is what I do. It works for me, and
Yeah.
hopefully it'll work for you too.
Good deal. So, what was the starting point of you looking at medicine actually as your career? That was something you really wanted to do.
Um, I I think the beginning of it wasn't like the most romantic. So
Mhm.
my family is Nigerian and we came like I was born there and we came here when I was 5. And I feel like in a lot of probably a lot of other like, immigrant families, the goal is kind of just like be successful, like have that American dream. And I feel like going into medicine is kind of an emblem of that in a lot of ways. And so I kind of feel like the path was like made for me, kind of. And, but I like now that I'm, in medical school, I realize that I'm really a big like people person. Like I love, like making connections with people, hopefully making connections with patients in the future. And I really like the like, I don't know, the like analytical aspect, your problem solving, like someone comes to you with like a bunch of different symptoms and you kind of have to do the work to put the puzzle together. So I really like the like analytical aspect and the interpersonal uh, um, part as well. Plus, like I feel like in medicine, you're really making an impact in someone's life, because they come to you, they're sick, and you have the ability to make them feel better, in whatever way that is. So.
Beautiful. I love that you have already seen where your path can not just be conventional, that it's other ways that you can also, besides just prescribing medicine or referring to other medical specialists, that there are ways that you've already now begun to think about that can help your patients. So that's wonderful. I can see that you will have the most excellent bedside manner.
Oh, thank you. I appreciate that.
Who are some of the people who you would consider your influences that were kind of like you were their mentees or they were your mentors? Who were some of those and what was the impact they had on your life?
Yeah. I feel like growing up and in the past, I was a very shy person until kind of pretty recently, like until a couple years ago. So I feel like seeking mentorship wasn't something I did too much, but I've since come out of my shell. And in medical school, I feel like I found a couple of good mentors. They like we get assigned mentors, and one of them is Dr. Mahalik and then Dr. Strasser King. And so I think it's been really great having a resource to, when I'm feeling really stressed about med school or kind of like I don't know what what I want to do, like what path I want to go down. It's been really nice having the perspective of people that have been in my position, like they can see the bigger picture and they're able to kind of like calm me down and be like, okay, these are the things you need to focus on, don't get lost in the fluff, like, what do you like to do, what do you want to do, focus on those things, it'll all work out. So it's been definitely really nice having that, yeah, just having a good perspective to lean on.
Excellent. So where are you in your path now in med school?
I just started my third year of medical school like a month ago.
Okay. How does that feel?
It feels good. It's definitely different.
Yeah,
The clinical side of things is different than like, pre-clerkship.
right.
I like that you're like interacting with people a lot more, and it's really cool to see, the different like disease processes that you read about. Like it's cool to see that like in action in person, but it's definitely tough like balancing, you're in the hospital all day and then you also have to come home and study for your shelf exam. So that has been a big adjustment. But I definitely like, like working as part of a like healthcare team, like I'm definitely learning a lot, and it's nice to have that like hands-on experience. And even though as a medical student, you're not the one that's really making decisions, but I feel like you can still like form a relationship with your patient and like you make a small impact in them, and that's been really nice to experience.
That's beautiful. That is absolutely beautiful. It sounds as well, though, although you're saying it's a challenge and it's different to be able to be doing clinical and then still have to come in and study. I can also see where having that hands-on makes what you study more practical. Instead of it
100%.
just being, a lot of terms, a lot of things to remember, it's like, oh wow, I'm dealing with this, or I may end up dealing with this.
Right. No, that's really true. Yeah. It's really nice when like, you get a practice question and it's like, oh, like I just saw that in clinic today. Like this is so easy. So yeah, that's definitely very true.
Excellent, excellent. So when it comes to physicians working together, Dr. Jackson started it mainly, as I said before, to bring the medical community together and bridge the gap between that community and lay people, those that they serve. How do you see PWT working, or you necessarily working with PWT in the future to also help in bridging this gap?
Yeah. So I'm really into like mentorship. Like I said, I really like people, forming relationships with people. And, at my school currently, like there's a couple, mentorship opportunities that I've been able to be a part of. Just like giving advice to younger classmen. And especially as, as a Black person in medicine, there aren't that many of us. And so it's really nice to be, a friendly face that's, doing certain things, and it's like, hey, if I can do it, like, yeah, it's tough, but if I can do it, you can do it. And so I can definitely see myself maybe like, once I become a physician, paying that back and like, continuing to mentor, other medical students or, college students, high school students. So yeah, it's definitely something I'm very interested in.
Excellent. And we've definitely been talking about doing some things in local high schools to capture the attention of those who are already starting to think about medicine and helping them along the way. So it's great to hear that you already are thinking about how you can be able to pay it forward, if you were, give back, if you will. So with that being the case, um, when you complete and you are a physician, what is something that you would look for, um, the ones who are veteran physicians that you would go into a clinic or hospital, wherever you end up working? What is something you would look for from them?
Ooh. Um,
And when I say that, I'm thinking more on the lines of sometimes those who have been in a particular profession for a while, they become maybe kind of callous to some of the things that happen with those who are just coming in, and maybe even I know what I experienced. There was some when I first came into education, particularly in administration. It was a thing that you had those who were very helpful and those who were just kind of, well, just not. I won't use the word I started to use, but just not very helpful. So when I ask that question, I'm kind of saying, what would you like for them to remember about when they first came in and be able to do for those who are coming in as like yourself?
Yeah. I'm thinking because just started my third year, so I'm kind of
Mm-hmm.
being, different physicians and like what are the
Mm-hmm.
things that I like for the physicians that I like working with, what do I like about them versus,
There you go.
the um I think one um I don't know, like you said, like people tend to get pretty callous in the future. And so I think just remembering that like medicine, I mean, it's a pretty big privilege to be able to, you know, to have the breadth of knowledge that we have now, but people, come into your office and they really, really trust you to, find an answer, find a treatment for them. And so just like hold on to that, like don't take it for granted and don't, minimize patient struggles or, ridicule them because, they didn't go to medical school. They hadn't been practicing for years and years and years. And so just kind of remember, they're a person with a problem and they want you to solve it, so just continue to treat patients with respect, I would say. I feel like that's, that sounds like it would be common sense, but I don't know. I've definitely seen some physicians who don't remember that. And it's a little bit rude.
That's a really good point. And I kind of made the statement before about I'm sure you're going to have great bedside manner just because of how you're approaching things. And I think that that's the thing as a layperson, uh, that they would want, that everyone would want. And that in that same position, the physician would want if they were the patient, just to be treated as an individual, as a person, treated humanely, and treated well. So we've got, um, we have almost 10 now scholarship recipients. What is something that you think PWT could do in working with you all as recipients of the scholarship award, uh, to reach out to even more future recipients to get our net spread wider? What would be a suggestion that you would have?
Um, I think social media is a big one. And like I said, that one, group chat that
Hmm.
that I found out about PWT in, just continue to spread the word in those ways. I'm not really sure other than like social media and like
That's
group.
good.
Yeah.
That's good. We're thinking about doing something with all of you guys together at some particular point. We have a big gala coming up next year, and would definitely love to see where you are in your in your work, and how even still you've been giving back in the community in some kind of way. What is one of the things that when you, as we start, closing this particular interview down, what is one of the things that was the most challenging about your um, matriculation through med school, even from um, your first college experience up to now? And what would be something you would say was the most profound thing that has happened? One of the most challenging things, and then one of the most profound things that has happened affecting you.
Hmm. I think in terms of most challenging, it's an arduous process. And I think like there's just so many things that you need to do, to get into medical school. and like financially it's a big toll as well. And so I think kind of just dealing with the stress of it all, of, like I want to, I don't know, do as many extracurriculars as I can while also balancing like your own like personal life, or and also, during the med school application process, like I want to make sure that my essays and like my MCAT is as good as I need it to be. And so I don't know, I feel like it's just a very like anxiety inducing process, and managing that was the toughest aspect of it for sure. And then the most profound, hmm, I'm not sure. Can you give like an
Would it be a
example?
takeaway? If you
Oh,
had, if you, yeah, I think that's what I'm most looking for. If there was something you was to say to someone coming after you, what would be your advice to them?
ooh, that's a big question.
Yeah. And I think
Um,
you covered some of it in the fact of, kind of getting your mind ready
for
that
sure.
this journey is going to be arduous. It's going to be a task.
Hmm. I think, yeah, kind of in a similar vein, like wellness is really, really, really important. Like medical school is not the only thing that you should be focusing on, I think. Like,
Yeah.
and because it's just such a very arduous process, like it's really easy to get consumed by it and get overwhelmed by it, but it's really important to, you know hang out with friends, like maintain your relationships, like exercise, like go outside, see the sun sometimes, you know what I mean,
Yeah.
get a hobby. Like I think like maintaining, well, like being very intentional about maintaining your wellness, see a therapist or something, like seek help in whatever way you need. I think that's really the most important thing, I would say. Med school is not the only, like it should not be your number one priority. Obviously, you should strive to do well, but there are other important things in life.
So basically, keeping balance, making
Yeah.
sure that you have something that causes you to have um, an outlet.
Yes.
Um, Kind of like on the pot when you're cooking, it's got that stem, a steam valve, so that you can release the pressure.
Yeah,
So make sure you
100%.
have something there in place. And I like how you say be intentional about that. So from the beginning, as a student, understand you need to have some kind of outlet. You need to
Yes.
do well, you need to stay focused, but have an outlet so that you can still be a whole being.
Yes. Yeah. Put it in your
Beautiful.
calendar, 30 minutes of nothing, 30 minutes of TV, even. Like, just be intentional about those things.
Very good. Well, thank you. Well, is there anything you would like to say to Dr. Jackson about receiving this scholarship and what that means to you?
Yeah, I want to say thank you so much. It's been a huge like relief to be able to, like I said, like buy the resources that I need to, and like be able to focus on my studies while not having that financial burden. And again, like I really like that it's a talent competition, and that you're, showcasing people's unique skills and their interests outside of medicine. And yeah, I think it's great work you're doing, trying to connect the physicians with the lay people. It's awesome.
Beautiful. Well, thank you so much, Ms. Pandu, for your time, for speaking with us, for sharing your gift with us in the way of your crochet art. That was beautiful. I
Thank
have a
you.
challenge for you as we close, and that is maybe do you think you could do something that would have PWT's insignia inside of it?
Like make a crochet thing.
Yeah.
I don't know if I'm that talented quite yet.
That's why I say it's a challenge. And maybe not for now since you're in your midst of your studies, but that'd be something you kind of think about.
Yeah, maybe.
But yeah, we love seeing what you do and how you presented it was very good as well.
Right.
So to everyone who's watching, thank you so much for your support of PWT. We ask that you continue to support not only just by your likes and your subscribes, but also when you can pour into us financially, this is where it goes. It goes to help these future doctors and physicians that our world desperately needs. So again, thank you. This is Eric Funches, the Executive Director, signing off, saying have a good day and live life well.